Hi, and welcome to Prisma Health, Business Health Solutions, COVID and Wellness Weekly Update. I'm Dr. Rachel Brown. I'm the Medical Director of Prevention and Wellness, and we're here to talk about all things COVID and make sure you're as up to date as possible on everything you need to know. So let's start with our status update. I'm going to keep it pretty simple. The good news is all the numbers are coming down across the state. So the incidences per 100,000 folks are coming down. The percent positives are coming down. The average percent positive across South Carolina for the last 2 weeks was around 9.1, and many counties in our state are below that 10% mark consistently. So this is all really great news. It does not mean that we can stop the precautions that we're using. In fact, it is because of those precautions that we're seeing this improvement. So continue to wear masks, continue to socially distance, continue good hand hygiene, continue avoiding travel when you can and gatherings, and we will get this number down. And let's talk about the biggest and last piece of that puzzle, and that is vaccinations. We have been hearing your frustrations and impatience. Folks are wondering, when am I going to be eligible? Folks who are already eligible are noticing that sometimes it may be difficult to get the process initiated or finished. And the reason here is that in our nation, there are only so many vaccinations for each of our states. And so South Carolina does not receive 100% of its requests each week. But what we do receive, we work as hard as we can to get out to the folks who are eligible for this vaccine. Now, you may have noticed in the last week that it has been difficult to schedule an appointment if you are eligible for your first dose, and that is because we are working very diligently to get second doses in the arms of folks that have started their vaccine process. Once that catch-up is complete, you will see that those first dose walk-in appointments become more available. Now, the rest of this update is going to be about resources, where you can go to find the information you need and that you can share with your employees so that they feel informed as well. So I'm going to start sharing my screen right away. And we will begin with some of the resources already seen. So let's start with the DHEC site. Now, if you go to the South Carolina DHEC COVID-19 vaccine page, you're going to find a timeline, but more importantly, you're going to find particulars around who's currently eligible. So there haven't been any changes since last week, but you can see we are immunizing folks 65 years of age and older, folks who are involved in healthcare and frontline providers. But let's look at 1B, because many of you as employers are wondering when your workers might be eligible. And again, not much of a change from last week. We've got some essential workers groups listed here. These are certainly not all of the essential workers that you would find listed by ACIP and DHEC. But these are the ones that they're anticipating prioritizing, and they tend to be the folks that have a higher risk of exposure due to work. Just like we saw with 1A, we do anticipate that this list for 1B, once phase 1B is initiated, will become more and more detailed. So keep an eye on this page to know when and who is eligible for vaccines. Of course, you can always reach out to us and ask us as well. And if you do have folks who are eligible, let's see if I can get to it. There we go. This is the best page that we have at Prisma Health right now, and it is updated in real time. So if you have a portion of your workforce that is eligible, you're going to want to have them visit this site. There are very clear directions on how to sign up for MyChart, which is our new registration and scheduling system. We are no longer using VAMS. If folks do not have a computer or access to Wi-Fi or do not feel comfortable with technology, there's a number that they can call, and we will do this process for them. The most important button on this page is the vaccination site. So let's click on that and take a look. What you're going to see is a list of all our vaccination sites. And please understand, this is changing all the time. There will be some sites that are not as busy or efficient, that will close to consolidate with other sites. We will be opening new mass vaccination sites in the weeks to come. So keep an eye on this site. But as you scroll down, you can see that at each area where we administer vaccines, it will clearly tell you what the status is. So right now there are no first dose walk-ins, and accepting second dose walk-ins. It will tell you hour by hour. This is updated based on weather, based on delivery times of the vaccine, based on allocation. So please encourage your workforce to check this webpage before you go to a vaccine site to be sure, again, they're not a second dose person who's just going to go for a walk-in. That's not going to work here at Baptist Easley today, okay? But this is constantly changing. So I'm going to stop sharing my screen for just a second so we can talk about some other updates. So I have a list of waiting fors. These are the things that we know are coming, that we're excited about, that I just want to keep reminding you are out there. Certainly, we're going to see expanded vaccine access as Moderna becomes more available to folks outside of long-term care facilities. At Prisma, we are right there in line for that Moderna vaccine. We can't wait to get it because we know that that is going to allow us to put that in ambulatory care, primary care sites, mobile unit initiatives, and even on-site vaccine clinics that Business Health can host. This is a much easier vaccine to work with in terms of logistics, and that will open up a whole new set of opportunities for access to the vaccine. The other things that are coming is, again, based on the availability of Moderna, but also you're going to see vaccines in more retail pharmacy sites and Prisma Health pharmacy sites. So keep an eye out for that. You may have already seen that happening in some local CVSs. And also, let's keep our eyes out for the self-enrollment portal that DHEC has been working on. That I have a feeling will become even more available when phase 1B opens up, and more details on that to come. And then lastly, the biggest waiting for is the Johnson & Johnson COVID vaccine. This is a one-dose vaccine. It does not need to be frozen. It can be refrigerated. It is not an mRNA vaccine. It's what's called a viral vector vaccine. It contains no live virus and no genetic material that can reproduce, so it is safe. This is a type of vaccine that we use in all kinds of vaccines that have been used for centuries. That is supposed to be reviewed by the FDA's Independent Vaccine Advisory Committee by February 26th. So hopefully in March, we will begin to see Johnson & Johnson on the shelves, so to speak. So let's go back to sharing my screen so I can share some more resources with you. As I promised, I wanted you to have these at hand so that you could share them with your employees. All right, we're going to talk about some new recommendations around quarantining. So again, let me see if I can find this here. All right, what I have done is gone to the cdc.gov vaccines page. And if you scroll to the bottom, you're going to see some recommendations for vaccinated folks. Now, first, let me start off by saying that if you have a portion of your population because of age or maybe what they do for work that has already been vaccinated, we are still encouraging these folks to wear masks, socially distance, avoid gatherings, avoid travel. There are a few reasons for that. One is we aren't 100% sure that folks who've been vaccinated still can't carry the virus and transmit it to others. The evidence is looking good that that is a low possibility, and that will be a part of why these new recommendations I'm about to discuss have been put forth. But the other part of that is because of the issue of variants, which we'll talk about in a moment as well. But because of that low risk, what the CDC is willing to recommend is that folks who have been vaccinated, as long as it is greater than 2 weeks from the final dose of vaccination, so that would be the second dose of Pfizer or Moderna, or the one dose of Johnson & Johnson once it comes out, as long as they're 2 weeks out from that final dose, and within 3 months of being vaccinated. So this is only relevant for the first 3 months after vaccination. If they're exposed to someone who's COVID positive, these folks do not necessarily need to follow one of those 3 quarantine strategies that we've talked about before for exposures. They do need to continue to be vigilant monitoring for symptoms for 14 days. And of course, all of the precautions need to be taken. And they may consider just sort of limiting exposure to others in case they still can transmit that virus through an asymptomatic infectious state. But it is felt that vaccinated folks have a much lower rate of transmission, and so there is not a need for quarantine if you're in the first 3 months of your vaccination state. That's fantastic for you as employers, because that means that if you do have some folks on your workforce who've been vaccinated and they are exposed to someone with COVID, they don't necessarily need to be sent home for 7, 10, or 14 days to quarantine. The same is true for someone who has had COVID. So if someone is COVID positive and they have recovered, they have finished their isolation period of 10 days, and they are exposed to someone who is COVID positive within the next 90 days, so again, 3 months, they too do not necessarily need to quarantine again. Please remember, we still want to mitigate any possible risk of an asymptomatic transmission by monitoring symptoms, wearing masks, socially distanced. So those are some new recommendations around quarantine that may impact your workforce policies and absences. The other thing that I want to mention that may also impact some of your hiring policies, especially around new hires, if you're an organization that requires a tuberculosis screening, whether that's a blood test for quantiferon or a skin test, tuberculosis skin test, you're going to want to defer that testing until 4 weeks after someone has received the vaccine. Okay, so if a new hire had the ability to get the vaccine right before they're coming in for, say, their new hire physical, wait 4 weeks before you place that skin test. Some organizations are opting to go ahead for going ahead and testing for TB. If it's positive, of course, we're reacting to that. The vaccine will not cause a false positive, so that is a true positive. But if the test is negative, they then repeat it in 4 weeks. So you're going to want to confirm a negative test at that 4-week period after someone receives the vaccine, if TB surveillance is part of your workforce policies. All right, let's talk about those variants. I'm getting a lot of questions about variants right now. And unfortunately, a lot of my answers are we don't know yet. But if you go to the CDC website under transmission variant, you will find the information that we do know. And the bottom line here is that, number one, we expect variants and mutations in every virus. This happens all the time. However, when those variants become common, they are called strains. So we know right now, for instance, that we have a UK strain and a South African strain and a Brazilian strain of COVID, and when they have characteristics that sort of change the public health response. So for instance, we know that some of these variants are much more infectious. They are more easily transmissible. That's going to mean a little bit more vigilance around our precautions. We begin to pay attention to that. And of course, since we're in vaccination season and we're working so hard to bring vaccinations to folks for the COVID vaccine, we want to know, are the variants covered by those vaccines? So the second bit of information I want you to give about this is I want you to understand about this is I want you to think about the flu vaccine model. We give the flu vaccine every year in the hopes of preventing flu in some folks, but the real strategy and the real benefit of that vaccine campaign for flu is to reduce the severity of disease in folks who would have very high complication rates from having flu, and prevent hospitalizations and deaths from flu in folks who are susceptible and at risk. So while the flu vaccine may not give us a 95% eradication rate or effectiveness rate like some of our COVID vaccines do, we still use it because we know that it is effective at mitigating some of those worst consequences. And it has a pretty good effectiveness rate at just keeping us from getting the flu. Not anything even close to what we're seeing with the COVID vaccines, and yet we still use it as a strategy because it's effective. If you think about COVID vaccinations the same way, while we love the fact that our mRNA vaccines are 95% effective, we should also be welcoming of the fact that even if they're not 95% effective against the variants, they still seem to confer a high rate of protection against severe infections, complications, hospitalizations, and death. And that's ultimately still and always a very important marker for a good vaccine campaign. The third sort of bucket here of information is that the vaccine manufacturers are already tweaking these vaccines to begin to be more effective against the variants. So when you put all three of those sort of expectations and understandings together, we realize that this campaign is still incredibly important. We are addressing the variants. Researchers are watching very carefully. And what's happening, you'll see more and more, is what's called genomic testing. So that when we find a COVID infection, someone is COVID positive, we're also sending that sample off for genomic testing to find out, is this a variant that's caused the illness, or is it the novel coronavirus vaccine? And as we get more and more information about the variants, we will begin to understand their transmission patterns. How is the vaccine affecting variants? How is that impacting variant spread, and so on and so forth? So stay tuned. All the preliminary information looks very positive, but we need to look at it through the lens of what vaccine campaigns are really intended to do. All right, and follow this page. It has a lot of great information for you. One of the other things I want to show you is a flyer that Business Health has developed to help you in communicating with folks who may have some concerns about getting the vaccine, or what we call vaccine hesitancy. And there's some information here that may shift the framework and may shift the perspective about why it might be important to get this vaccine. Of course, we are always available to talk to your employees and your workforce about the vaccine and provide them with the information they need to make that decision. This flyer, of course, is on our webpage and will also be administered to our business client list, email list. But let us know if you need help with this, if you're getting questions around from folks who aren't really sure, and you're not sure how to answer those questions so that they can make the best decision. And then finally, the best way to do that is to head to the Prisma Health Creating a Safer Workplace page. This is where you can reach out to us. Right down here, there's a number that you can call. We can set up an email, or excuse me, I can answer questions via email, or we can set up a consultation call with myself and the team, whatever it is you need, even site visits to help you to work through your policies and procedures, or just get your questions answered and be able to share information with your employees. The videos I do each week are here if you want to hit watch now, and you can easily share these with your workforce if you're interested. They could benefit from this information also. So that's it for this week. We'll be back next week where we'll talk a little bit more about who is in the 1A category. We may see teachers shortly and other educators added to that list, and certainly updates on where to go for the vaccine and how to manage your workforce in this time of COVID. As always, Business Health Solutions is here for you, caring for you so that you can care for your workforce, and I'll see you next week.